attending this special meeting. It is the appointed time and we have a quorum. Let me call the meeting to order. Let us invite the deputations, including individuals and organizations, to come in, and also the administration. The administration issued some papers, and also the information note and background brief prepared by the Secretariat have been circulated to members. Members, there are over 40 deputations coming today, so the meeting will be held in 2 sessions. After the first session, if you have questions for the deputations, you can ask them. And then after the second session, we can ask the administration questions. This will be easier for time management. Thank you very much, deputations, for coming to this special meeting of the Health Services Panel to express your views with regard to regulation of medical beauty treatments and procedures. I'd like to tell you that at the meeting, when you speak, and also with regard to the submissions you make to the panel, these will not be covered by the Legislative Council Powers and Privileges Ordinance. In other words, whatever you say and also your submissions, that will be the subject of legal responsibility to be borne by yourself. You will each have 3 minutes. Please be concise. If you have more to say, please do so in written form. All of us will be listening into Cantonese, right? Because Channel 2 is English, Channel 1 is Cantonese, and Channel 0 is the floor. Let us start. The first one to speak is Mr. Alan Leung, Vice President of the Hong Kong International Professional Trainers Association. Can I start? Yes, you can start. 3 minutes. Good afternoon, members. I am Alan. I represent the Hong Kong International Professional Trainers Association. We'd like to make 3 points to the medical sector and also the administration. Number 1, we believe that if a registered Western medical practitioner is responsible for this one, then the relevant company should take up 100% of the responsibility. However, some doctors have shirked the entire responsibility to the beauty sector, and on different media, they have said that there should be more control on the medical sector. And consumers now have the impression that the death was caused by the beauty sector. At the same time, they exert pressure on the administration to make regulations so that the beauty sector is stifled, and you also seek to affect our operation. Actually, when there was breast augmentation done by a Western medical practitioner, meaning a beauty procedure, however, the wrong use of aesthetics led to death. Why is it that the doctors who spoke on TV and radio did not say anything about this? On the contrary, the beauty sector never caused any deaths, and we have never done anything that caused cancer. However, the medical sector, with regard to skin abrasion or inflammation, they were making a whole fuss out of it. They said that the beauty sector can be likened to a monster and should be killed off immediately. Our association unanimously supports the regulation of the use of risky equipment. We also think that injections and medication should belong more to the medical sector. We believe there should be training for beauticians. There can be also some examination system so that we become professionals, so we can serve the public better. Actually, there are about 100,000 beauticians and hairstylists. They also have different kinds of international certification. They can be university professors. Sometimes they are doctorate, masters and graduate degree holders. There are many of these. So I believe that a beautician with professional training would be able to provide service as well as a nurse, a general discipline nurse, and also general practitioner, and also like a midwife. I hope you understand. Please, the medical sector, please do not try to monopolize the market and stifle our survival. Actually, just like in South Korea, doctors there say there should be fair competition and complementarity, and also there should be mutual support before we can have some progress. This is my request made to the administration. Thank you. The second one, Dr. Che Hong Hing, President of the Hong Kong Medical Association. Thank you, Chairman. What are we seeing? A citizen was subject to intravenous infusion, and there was serious infection. There was 1 death and 3 people are still in hospital. We can see that there are people who have not been trained and who do not know what risks there are involved, and also there are non-medical professionals who do not know how to identify complications, and they are actually making use of very complicated medical laser procedures. Some people make use of pseudo-scientific theories, saying that the so-called intravenous injection of processed blood can enhance health. They say that there are cosmetic effects. They are employing doctors without a name. We don't know who they are. They are registered doctors, but then in the center they do not identify themselves, and yet they provide service to the public at these centers. These doctors perform invasive treatments, but they do not disclose their identities to patients. When complications occur, patients cannot seek compensation, and the medical council just do not know who were the doctors, so no follow-up could be done. Corporations employing doctors to perform invasive treatments are currently under no regulation, and there is no registration system. The existing laws, including the Medical Registration Ordinance, Undesirable Medical Advertisements Ordinance, and the Trade Descriptions Ordinance, are inadequate to regulate these beauty centers.
We have a few suggestions. First of all, we have to find what's meant by medical treatment. We have to ensure that such treatment is performed by registered doctors. As to the definition of medical therapy, we have to rely on you, electrical members. Please don't filibuster anymore. Such doctors should be registered with the medical council, and such centers must have directors who are doctors, and they must bear responsibility for their dereliction of duty and mistakes. And pseudo-medical advertisements that are misleading should be eradicated. The Customs and Excise Department should proactively investigate into such advertisements. Only registered doctors can use high radioactive therapy. Untrained personnel should not use related equipment. The Medical Council has never asked the administration to regulate the beautification industry. We just want the administration to regulate so-called medical advertisements and personnel who are unrelated to the medical profession, and their behavior is immoral and irresponsible. Next, we have Ms. Rinbo Chan from the Hong Kong Hairdressing and Makeup Trade Workers General Union. Good afternoon, members. I represent our General Union and the voice of the industry. Many beauticians have been affected by the incident. In particular, the DR staff were laid off, or their salaries and income had been affected. So I'll be brief. The administration should legislate as soon as possible, such that medical and beauty therapy should be separated. Doctors are doctors, beauticians are beauticians. Members of the public should know very well what should be done and what shouldn't be done. And beauty advertisements should be regulated. We must not allow movie stars to affect the choices of the public. The government should as soon as possible collect public opinion. Thank you. Next. From the International CICA Association of Aesthetics, we have Ms. Sarah Law, the Executive Vice President. Good afternoon. Today I'm speaking on behalf of the International CICA Association of Aesthetics. Well, this incident is actually a medical error, but the responsibility has been placed on the beauty therapy industry. In actual fact, the administration has not clearly defined the medical profession, medical therapy, and beauty therapy and beauty treatment. In overseas jurisdictions, there are clear definitions, and beauticians have to be well-trained and obtain a certificate. In fact, in Hong Kong, many beauticians have obtained qualifications from China, Switzerland, the UK, and Australia. However, Hong Kong has never got any accreditation system for beauticians. In 2005, we took the lead to match the qualifications framework for Hong Kong and set criteria for beauticians. Their qualifications are recognized by society. Under the qualifications framework, and with the assistance of professionals, in November 2010, we had published an explanatory memorandum to classify beauticians, their professional status and skills. And the Accreditation Authority of Hong Kong fully subscribes to our criteria. And our beauticians know very clearly what items they could perform, including professional services and beauty therapy. Well, members of the public do not understand the development of our profession. Our industry has developed in Hong Kong for several decades. We have always exercised self-discipline, and we've never cost any life in the past. For breast augmentation and other treatment, there were incidents because of malpractices. And even in the medical profession, we rely heavily on the ethics of doctors. And in this incident, fingers were pointed at our industry. I think they're passing the buck to us, thus hugely affecting the healthy development of our industry. I'd like the administration to face squarely our aspirations. Next, from the Hong Kong Beauty and Hair Care Employees Union with Ms. Sandra Choi, their General Secretary. Good afternoon. In November, we conducted a telephone interview for the sake of this special meeting. We interviewed the respondents, and they've never got intravenous injection, fat extraction, injection, etc., etc. They've never performed such treatment. Our interviewees support legislation on the part of the government. Well, what about laser and all sorts of equipment used by beauticians? Well, Dr. Zhe just now mentioned laser equipment and laser equipment. Well, we've been performing such therapy for over a decade or even 2 decades. It is very difficult for us to imagine that in future customers will have to find a doctor to remove the hair from their skin and so forth. And what about laser washing for the eyebrows? We've done this for over a decade and we've never caused any casualty. Now, we interviewed members of the industry, and they're of the opinion that we can continue to operate as what we are doing. And we made reference to the legislation in Singapore for skin erosion, for example. If that is not to be done by beauticians, the livelihood of our beauticians will be hugely affected. If you adopt a broad brush approach, I'm afraid you'll be met with an outcry from the beauticians. As Dr. Zhe said, we would also like the administration to differentiate clearly the medical profession and the beauty treatment profession. We, of course, don't want to perform injection, blood extraction, etc. for our customers. But there must be clear differentiation between our industry and the medical profession. For existing treatment performed by us, we would like the administration to do regulation and accreditation. Next, we have Ms. Fanny Leung, District Developer of NT West from the Civic Party. Good afternoon, members. The beauty treatment industry has never been put under regulation, and the recent incident has aroused public concern. In 2004, we've got a code for the industry, a set of guidelines for the industry in order to ensure that consumers have sufficient choices and satisfactory services. Still, regulation has not been sufficient. Recently, there has been a rise in the number of complaints about beauty treatment. The situation is worrying. Members of the public have also been complaining more about causes of treatment. Consumers deem the situation serious. However, the administration has not done anything. As a result, members of the public are not duly protected. Therefore, the administration should, as soon as possible, legislate to regulate the industry. In fact, our industry started more than a decade ago, and we've been asking for legislation and regulation over a decade ago, but the administration has not done anything. Heavy metallic intoxication incidents did occur. The administration treated those incidents as public health incidents only. And this particular incident has revealed the insufficient regulation on the part of the administration. In the administration's document to this panel, we saw 2 ordinances that had not been revised since 1960. That is the Hospital Nursing Homes and Maternity Homes Registration Ordinance, Cap 165, and Medical Clinics Ordinance, Cap 343. Now, both ordinances are mainly to regulate medical institutions. And a steering committee for private institutions had been set up. But then the steering committee will only examine the framework of the institutions. Obviously, the administration have only been adopting makeshift measures. The administration has no intention to regulate our industry, the beautification industry. Now, the Civic Party has the following suggestions. Medical beauty treatment should be regulated by way of legislation, and treatment institutions should be penalized if they contravene the provisions. Qualifications of their personnel should also be accredited and regulated. And unscrupulous sales practices should also be tackled. False beauty advertisements should also be targeted. We would like the administration to adopt these measures as soon as possible. Next, Ms. Winnie Ma, President of the Hong Kong Beauty Management Development Association. Good afternoon. The DR incident has caused 1 death and amputation of limbs in another case. Now, we are very saddened by the incident, and it's also a very sad incident for the family members of the affected. And in the media, there are a lot of adverse reports about the beauty treatment profession. This indicates that the administration has not been duly regulating the industry. Well, all sorts of advertisements on all sorts of treatment have been advertised, but they're actually medical acts. Did the administration regulate such acts or face such incidents squarely? No. The beauty treatment profession has been in existence for decades. There's never been any incident. In fact, we've contributed a great deal to society. We would like to urge the administration to regulate the private sector as soon as possible, and medical procedures and beauty treatment procedures should be defined clearly. There must be a watershed to classify medical services and beauty treatment services. And an accreditation and licensing system should be set up for the beauticians to boost their recognition. And the administration must face the room and future of the development of the industry such that we can survive.
Thank you. The Hong Kong Beauty and Fitness Professionals General Union, Ms. Amy Hui Wai Fong, Chairman. Thank you. On behalf of the industry, I'd like to say something. I'd like to say that medical beauty or aesthetic medicine should be regulated, but there should not be a broad brush approach adopted towards the beauty industry. Many organizations have said that the humidifier or high-frequency equipment or even ultrasound equipment have always been used by us, and no incidents have occurred. Plus, now beauticians don't only rely on skills or technology. They do not only rely on the product. Therefore, in terms of regulation, we should delineate between medical procedure and beautification procedures. That's all. Thank you. Next, Hong Kong Doctors Union, Dr. Yang Chiu-Fat, President. Thank you, Chairman. When a citizen falls sick, he accepts treatment. That is what he needs. But when he does so, there are risks involved as well. There may be side effects. But if a person is not sick and he undergoes beautification procedures, then there should be more regulation, because this person is not sick. If anything should happen, say for example you use laser or IPL, as the other ladies said, there can be burns, and the Consumer Council has received many such reports. The DR incident is just the tip of the iceberg. A lot of other incidents have not been revealed. All along, the administration has turned a blind eye, but now with the new administration, they have set up this steering committee. The Hong Kong Doctors' Union support this. Medical and non-medical procedures should be delineated. Medical procedures should only be undertaken by registered doctors, and non-medical procedures can be undertaken by non-registered doctors. The question is, this is not enough. Like what we said, with regard to the regulation of private hospitals, you have the law, but nobody complies with them. Why? Because the boss has an ulterior motive, so you cannot regulate them. If we look at the professionals in Hong Kong, including lawyers, accountants, they are regulated by law. They have to be subject to the regulation of the law, and 90% of the shares must be held by people in that profession before a company can be set up by professionals to provide professional service, just like lawyers' firms or law firms. But then only in the medical profession, anybody can open a clinic, a butcher can open a clinic. And recently, I can see that within Asia, the beauty kingdom, of course, is South Korea. It is stipulated that you must be a doctor before you can open a clinic. It is also stipulated in South Korea that some beauty procedures can only be undertaken by doctors, like the ear piercing and tattooing. Only doctors can do those procedures, or at least under the regulation of a doctor. I believe this is the time for the administration and all of us to return justice and fairness to doctors. So companies and organizations providing medical services must be under the control of doctors. If they are under the control of businessmen, no kind of a regulation will be useful. Thank you. Next one, Hong Kong Hair and Beauty Merchants Association, First Vice Chairperson, Mr. Kong Shu Lam. Thank you, Chairman. The DR incident should be a serious medical incident. However, the beauty industry has been painted to be the unethical ones. We feel very helpless, and to the beauty industry workers who work conscientiously, we have no space to express our thought. And also, some educational institutes are recruiting trainees for eyebrow tattooing, etc. And it is said that their bosses, who are doctors, have asked them to enroll in those courses, and the bosses are telling them that this is to prepare them to take over from the beauty industry. We were alarmed because the beauty industry is now going to be replaced by the medical sector. The medical sector should work for the welfare of human beings. Why do you want to make huge profits so that you want to monopolize the entire market, and in the end there will be no choices for consumers? Why do you overlook consumers' rights? We like to reiterate that the beauty industry does agree that we should regulate professional conduct and also medical behavior, and we are now doing a self-review. We hope that by regulating medical procedures, you should not in the end via or hive off a lot of our beauty procedures to doctors so that they make huge profits out of it. We're also worried that if there will be this unfair and unbalanced situation, Hong Kong society and consumers will stand to lose. We hope that members and also the SARG will be fair to us. make use of a reasonable and civilized kind of thinking and delineate between medical and beauty services basing on the experience and competence of the operators. There should not be a broad brush approach, because this has to do with the prospect of tens of thousands of workers in the beauty industry. There will be a lot of in-depth impact on the beauty industry. Please exercise caution. Thank you. Next, Dr. Kenneth Fu Kam Fong, President of the Hong Kong Public Doctors Association. Thank you, Chairman. I represent the Hong Kong Public Doctors Association. First, I have to declare that I have no conflict of interest because the PDA is neutral in this, and we have an open mind. We work in public hospitals, so we have nothing to do with competition in the private market or benefits in the private market. And we do not belong to any particular specialty. We are not dermatologists, or we are not surgeons either. And we are not involved in any shareholding of beauty centers. We are just third parties. We just have some medical knowledge. We would be fair and objective in putting forward our view. In the DR incident, we can see that as the healthcare profession, as doctors, we are regulated by a lot of laws on a daily basis. For example, we are also under the regulation of the Medical Council. Also, there is the Nurses Registration Ordinance, and also Dangerous Drugs Ordinance, and Undesirable Medical Advertisements Ordinance, etc. We are regulated by these ordinances on a daily basis. I, for one, agree that we should have a regulation system for the beauty industry. If you look at security guards and also property agents, they have to be licensed. Why is it that the beauty industry is not subject to licensing? We call ourselves professionals. Now, if you call yourself a professional, you should be regulated by laws so that people know you are professionals. Or if you just tell your client you are professional, there is no backing for it. As for the regulation, how tight should it be? How detailed should it be? That can be discussed. I also agree that there should be a clear delineation between medical and beauty services. This is very important. I have looked at the Singapore guideline. I can see that the guideline applies on doctors, not on the beauty industry. It says that if the beautician is guilty of negligence, the beautician can be prosecuted. In the guideline, there are a few categories. They are about the procedures, high risk or low risk, invasive or non-invasive. But they also have regulation as to who should be providing the procedures, the qualifications of these people, and also where the procedures are to be undertaken. I think that is good reference for Hong Kong. Thank you. Next, Ms. Posa Lam, Chairman of the Federation of Beauty Industry Hong Kong. Chairman, members, the DL incident led to one fatality and a few injuries. We feel very saddened by this. The DL incident aroused a lot of worries amongst the public and consumers. They are worried about the safety of beauty procedures, and some organizations and political parties are saying again there should be regulation of the beauty industry. For example, the medical procedures should be stipulated, and also to restrict and regulate the so-called high-risk beauty equipment, and also a cooling-off period for consumers, etc. You have to understand that the operator this time around is a doctor. The company operator is also a doctor. The procedure was undertaken by a doctor. So please do not say that this is something the beauty industry has done. It was actually undertaken by a doctor. Please do not create procedures to suppress the industry. Such negative coverage certainly is adding to our difficulties. It is a kind of bullying on the beauty industry. The administration has set up the task force on beauty procedures under the steering committee. We welcome it. We welcome a clear definition on beauty procedures and medical treatment. But all in all, we have to start from the basis of protecting public health and also the health of citizens. When we have confidence between consumers and the beauty industry, we can continue to provide service. And at the same time, we must understand the value of the beauty industry. I'm a professional beautician. I have been the general manager of a beauty conglomerate for over 10 years. My position is that we should delineate between beauty procedures and medical procedures, and then they can provide different services and treatment or procedures so that consumers will be able to make an informed choice for the services they need. I have the following proposals. Traditional beauty service. What is that about? It is about beauty products plus skills and also some scientific equipment. And I'm not talking about injections. I'm only talking about laser and IPL. As for QF4, within that scope, it already includes the use of intense pulsed light and also training provided by the equipment supplier. In the QF system of the Education Bureau, it is clearly stipulated that QF 1 to 4 have been clearly defined, and the administration can look at that information. In terms of international training, we have accreditation and also accredited service scopes. You can see whether they can be applied to Hong Kong. In terms of the definition of medical treatment, if it is about injections and also high energy emitting equipment, these should be undertaken by doctors, and the consumers must understand that these are medical procedures and they must know that these are undertaken by professionals. If doctors are involved in beauty procedures, they must have dermatology and also cosmetic surgery certificates before they can also ensure the health of the general public. Thank you. Next one. Hong Kong Society of Plastic, Reconstructive and Aesthetic Surgeons, Dr. David Wong.
The Medical Registration Ordinance, Section 16, offers a blank check entitling all licensed medical practitioners to practice all fields of medicine, irrespective of their training. We think that there must be a clear stipulation of the required qualifications to perform various aesthetic interventions in accordance with those recognized by the Hong Kong Academy of Medicine. Second, the term medical beauty ipso facto means the application of medical interventions in enhancing beauty. We think that aesthetic interventions must be defined, or a list of procedures be drawn up to distinguish them from ordinary beauty treatments, which do not require the participation of qualified medical professionals. Third, medical devices like fillers, lasers, and high-energy devices are legitimately available to the general public. We think that the existing voluntary listing scheme of the Department of Health should be made compulsory as soon as possible, and regulatory control must be implemented as to the possession and control of relevant devices. Fourth, beauty parlors are providing medical services, as we can see. Medical institutions are regulated to much higher safety standards. Therefore, either beauty parlors are to be prohibited from providing medical interventions, or they must be regulated to the standards of medical institutions. Number 5. Laboratories in Hong Kong are regulated mainly as to their measurement precision standards only. Pharmaceutical products manufactured for private use might not be caught by the Pharmacy and Poisons Ordinance. Therefore, we think that there should be compulsory accreditation of the safety standards of all laboratories providing services or products in relation to human consumption. Number 6. The Undesirable Medical Advertisement Ordinance prohibits adverts of cosmetic interventions, but we can see that such are still in abundance in entertainment magazines and in the form of huge posters everywhere. And we propose that stricter enforcement is urgently needed. Thank you.
唔該晒。下一位發言嘅係香港。
Thank you. Next, Ms. Teresa Choi, Executive Consultant of the Hong Kong Association of Professional Aestheticians International. Mr. Chairman, members, good afternoon. I'm representing the Hong Kong Association of Professional Aestheticians International. In the early stages, we were basically working on the beautification of the skin. But as society advanced, we were also involved in the rectification of skin deficiencies. And throughout the whole world, we've been promoting an holistic approach whereby shortening the distance between our customers and beauticians. And we proceeded from skill acquisition to the acquisition of professional qualifications. So we have a whole series of qualifications. As for invasive surgeries, our professional beauticians have volunteered to join the VTC run equipment operation courses. Due to these involvements, I'd like to put forth a number of requests to LegCo members today. Some of our beauticians have already acquired certificates. They're trying their very best to serve their customers. We would like the administration to publish clear guidelines to allow them to have sufficient room for development. We would like the profession to continue to develop, enhance their quality of service, and contribute to the stability and prosperity of society. We've put forth suggestions on services and responsibilities on the basis of customer safety, and safe products should be provided to customers. As the whole world is moving towards a holistic approach, we would like to promote collaboration among doctors, beauticians, or even psychologists. Every member of the profession should understand his or her expertise, and professional guidelines and guide for customers should also be promulgated. After customers have received services, a report should be passed back to the institution that refer the customers to the beauticians. This is for the physical and mental good of customers. In fact, we do have internationally recognized qualifications for beauticians, and we do have tests and courses on various skills and technology. And we also have a training blueprint. Sorry, Ms. Choi. We've already received your written submission. You don't need to read it out. We can read it. Next, from Beautiful Locations Limited, we have their director, Mr. David Yip. Good afternoon, members. I've been in the industry for over 2 decades. At the beginning, I sold simple equipment. Now, I'm procuring advanced equipment. Before using a certain equipment, I always let my beauticians trained in professional courses before I allow them to serve the customers. We must always put customers first in order to safeguard customer safety. In the past few years, IPL equipment, radioactive equipment, radio frequency equipment have been in use. In 2003, there was a consultation in the LegCo. After that consultation, the IPL course started to be organized by the VTC, such that beauticians could receive professional training. Trainees could get a certificate upon completion of the training course in order to ensure consumer safety. In recent years, in the medical profession, a number of new developments have taken place. I agree that some acts are better to be performed by medical professionals, and there must be clinical accreditation. I understand that according to statistics, there are 50,000 members in our profession, benefiting 400,000 people. Therefore, the beauty profession cannot just follow the Singaporean policy. That is, we cannot just have medical beauty. We must not let the medical profession monopolize the industry. Otherwise, it's against fairness. The unemployment rate of society will be boosted, thus leading to livelihood issues. So I'd like to urge members to cautiously handle the value and survival of the beauty industry so that our consumers will have more choices. Next, we have Ms. Ip Weng Yan, Chairperson of the Hong Kong Dental Hygienists Association. Good afternoon. I'm representing the Hong Kong Dental Hygienists Association. At present, there's diversity in beauty parlors. Sometimes teeth are involved. That is, there are treatment procedures for the beautification of teeth as well. I'd like the administration to define beauty treatment courses to see whether or not they're really treatment. And the administration has to ensure that beauticians are well qualified to perform such acts in order to safeguard the interests of the consumers. I got some information from you in relation to criticisms on the Singaporean approach, but I don't see any regulation on dental treatment procedures. So is it necessary to categorize and regulate dental treatment procedures? Sometimes, even if there is a mistake, the life of the consumer may not be immediately threatened. But some treatment procedures, if they can be performed by dental professionals, may be safer. Otherwise, there may be safety hazards. Therefore, I'd like the administration to legislate on dental beauty procedures. Such procedures should be performed by dental professionals so as to safeguard the health and safety of consumers. Thank you. Next, Dr. Raymond Yong, Assistant Medical Superintendent of Hong Kong Sanatorium and Hospital. Good afternoon, LegCo members and colleagues. We would like to put forth 3 points. First of all, we very much support the administration's move to clearly define the medical profession and the beauty profession, such that the users can know very clearly how to choose their services. Secondly, people in the beauty industry, as mentioned just now, many of them received professional training. But then, when we define doctors who can perform beauty procedures, they should also receive special training before they should be allowed to perform the procedures. That's point number 2. Thirdly, about medical equipment. users of such equipment should be medically trained. Such equipment have been developing very rapidly in recent years, so we would like the administration to, as soon as possible, regulate such equipment. In 2008, the Department of Health published a regulatory document on the subject in terms of maintenance, repair, possession, use, etc. of these equipment. There must be clear definitions for the professionals. It's not just for hospitals, the medical profession or clinics. We don't want to have multi-standards. We should adopt the same standard in hospitals and clinics. Procedural requirements should be the same. Thirdly, given the development in the beauty industry and the medical profession, human cells may have to be processed in laboratories. So I'd like the administration to, as far as possible, accredit such laboratories such that the procedures can be carried out in a safe environment in terms of cell studies and preparation. Next, from the Service Industry General Union, the Hong Kong Federation of Trade Unions, we have their chairman, Mr. Ken Tong. Mr. Chairman, colleagues of the industry, good afternoon. Well, the DR incident is really unfortunate. Just now I heard from the doctors and colleagues of my industry different views. Well, doctors will not perform beautification procedures. The beauticians who perform such procedures will remain beauticians. They are not doctors, because you need to study for a long time before you can become a doctor. Very obviously, from the incident, we can see that medical beauty therapy has been performed by beauty parlors. So please, beauty parlors should perform beautification service. Well, for decades, there's not been any problem. However, sometimes beauty parlors are doing medical things. For example, in terms of cosmetics, invasive injection of cells, etc. So the administration really has to regulate the beauty profession. If you require beauticians to acquire a license or be accredited, it would be very unfair to our members. Members of our industry have always been serious in obtaining all sorts of qualifications. In Hong Kong, we do have a big accreditation market. Our colleagues love and respect their profession. They've tried to acquire all sorts of qualifications. If additional qualifications are required, the livelihood of our colleagues will be affected. Besides, they don't have time to be further trained. It's very simple. They are just beauticians performing beauty treatment. So you must draw a clear line between doctors and beauticians. Doctors should do their own work. Beauticians should also do their own work. And if there is to be any accreditation, there must be a dedicated body to accreditate beauticians. We must not allow doctors to accreditate us. So please protect well our beauty treatment profession.
會嘅監事長潘佩芳女士。
主席，各位議員，大家朋友好。由香港化妝品同業協會、國際私家美容協會、香港美容業總會、香港國際專業導師協會、香港國際專業美容師協會、香港美髮美容業商會、香港美容業管理及發展協會組成美容業大聯盟， 並於2012年11月19日，我哋舉行咗200多人嘅諮詢會，重申我。
We have organized an alliance, and on the 19th of November, 200 people joined a consultation forum, and we also issued a statement on the 19th of October. Altogether, when we have the following views with regard to future regulation of the medical and beauty sectors. The beauty sector and also Mr. Ko-wing-man have indicated clearly that the DR incident is a medical act. It is a high-risk medical act. What happened has nothing to do with beauty services. Secondly, the administration should ASAP delineate between medical acts and beauty services to protect the life and limb of consumers. Number 3, Hong Kong now has about 6,000 beauty parlors. About 10% employ more than 10 employees. 90% meaning 5,000 beauty parlors employ fewer than 10 employees. However, the total number of employees reaches 50,000. And this has to do with the livelihood of over 100,000 people. The administration said that we could make reference to the Singaporean system. We emphasize that since 2008, when Singapore implemented law and regulations, there has been a big blow dealt to the beauty industry, and tens of thousands of people have lost their jobs. We hope the administration will not overlook the livelihood of 100,000 people or more. Do not rob the poor to benefit the rich. Do not adopt such administrative measures in order to affect the healthy development of the beauty industry. Number 4, if members can clearly understand the difference between beauty service and medical acts and help the beauty industry keep a healthy and sound operating environment and protect the livelihood of 100,000 people, you will be doing a great act of faith. Number 5, as participants of the beauty industry, we need to have the right to take part in the discussion of any regulation of the beauty industry. We hope that we can join the steering committee on review of the regulation of private healthcare facilities, unless the administration can guarantee that issues discussed at this steering committee would never have anything to do with the beauty industry. Thank you. Next, Hong Kong Physiotherapy Association, Dr. Chris Wong, Chairman of the Electrophysical Therapy Specialty Group.
The recent incident causing one death and serious sickness of the 3 odd patients resulting from high-risk medical procedure from a beauty service company do brought in public concern about the regulation of medical beauty treatments and procedures. And in view of this, the Hong Kong Physiotherapy Association do agree that it is an appropriate timing for discussion with subsequent implementation on the regulation of medical beauty treatment and procedures to protect the public interest. However, the discussion has to be of broad base by inclusion of the relevant and interested party to balance the risks and the benefits of various counterparts. And it is well known that the physiotherapists contribute to the dermatological treatments and are trained personnel for operating electrical physical agents in the daily practice, in the hospital settings or in the community settings. And comprehensive curriculum related to the electrophysical therapy, such as ultrasound, laser therapy, or other light therapy, is well covered in the undergraduate program curriculum offered by the university. And moreover, under the CAP 359, Supplementary Medical Professional Audience, physiotherapists are required to register with the Physio Board, Hong Kong, under the Supplementary Medical Council, and observed requirement on professional conduct with disciplinary control of person engaged in occupations and professional supplementary to medical and for purpose connected therewith. So therefore, physiotherapists are competent in conducting the electrical physical agents and have to be exempt from any means of examinations or validation process upon the implementation of regulatory control on authorized person for treating those skin conditions using electrical physical agents. And in addition, the interest and feedback from the physio have to be solicited through the Hong Kong Physiotherapy Associations. And last but not least, the physiotherapists are well-trained personnel in delivering the electrical physical therapy and equipped with relevant clinical experience. As a result, we are eligible to be the instructor or tutor for any training of identified personnel in delivery of light therapy, laser, or ultrasound, or other electrical physical agents. Thank you very much.
唔該晒。下一位發言嘅香港美容出版社有限公司嘅總。
Next, Mr. Ip Sai Hung from the Hong Kong Beauty Press Limited. I'd like to declare interest. I'm not involved in any beauty industry work. I am only speaking from my observations. With regard to the regulation of medical procedures and beauty procedures, I believe that should be regulated, but we should also plan for it. The so-called regulation, well, these people today are saying that they should have their own territory, saying that there should be some kind of pork barreling, and they would like to have a bigger portion of the market. That's all. Today, the Economic Services Panel members are also invited here, so I'd like to tell you what situation we are facing. I think you are totally mistaken about the entire matter. This is the case because somebody has lied and people have deflected views. In fact, there has not been such a big incident like DR in the beauty industry. From beginning to end, from investor to the operator, it is a doctor and it is done in a clinic. It is in a medical product laboratory. It is a shame for you to say that this is related to the beauty industry. Only Cohen Man, only he himself has emphasized that this is a medical incident. Of course, he is not defending the beauty industry. He has an ulterior motive, and he is trying to do something what the last term of administration has been trying to do but has been debarred from doing, and that is regulation of private healthcare facilities. Now, when you look back, you will understand why. When DR incident happened and the blame was put on the beauty industry, and you didn't understand why the Steering Committee on Review of the Regulation of Private Healthcare Facilities was set up. Now you know, and many people are taking advantage of the situation. This is a medical incident, and yet the solution, now you say, is to regulate the beauty industry. You are blaming the wrong people. If you want to discuss medical beauty, I think you should put yourself in the big picture. Medical beauty is not invented by Hong Kong. It is mushrooming throughout the entire world. It's a huge industry. You cannot stick to your old rules. You must be modest in facing reality. You must understand beauty and medicine have been independent in the past, but now they somehow duplicate. There is a new area, and you have to regulate it with new concepts and new thinking. You cannot bury your head in the sand to say that there is no medical beauty in Hong Kong. If that's the case, Hong Kong can miss the opportunity to become the leader of medical beauty in the region. In Hong Kong, we have a business measuring hundreds of millions of dollars, and on the mainland, people are spending huge money on the industry. I hope we will not miss the opportunity again. We should not allow short-sighted people just to carve out the market. We must build a good market. We have to enhance the service safety, but it doesn't mean that we should allow everything to be done by a doctor. Like what the Audit Commission said, if there are medical beauty procedures that make money, then you go for it, and then you do not do anything that does not generate profits. That will lead to a place of mainland couples giving birth in Hong Kong. In fact, these are clients. They are not patients. Each sector has its own advantage, and we should expound our own professional skills in order to open a bigger market. We should not just do pork barreling here. Thank you. That ends the first session. Let me ask the Undersecretary to see whether there is any response to what the deputations have said, and if members have questions, maybe we can also ask members to speak. Undersecretary. Thank you, Chairman. I also like to thank the Legislative Council Panel on Health Services for arranging this special meeting. So we are here and can hear the voices of so many deputations. We'd like to thank the deputations for coming today to let us know your concerns. You and also the public have views and concerns about the use of high-risk medical equipment and procedures in beauty parlors, and we are enabled to understand the concerns towards regulation of the beauty industry and also regulation in other areas. Certainly, this will help us with our work at the Steering Committee on Review of Regulation of Private Healthcare Facilities. We have heard many voices just now that we should delineate between medical procedures and beauty procedures. And also, what are medical procedures and non-medical procedures? You have talked about different approaches to regulation. You have mentioned medical beauty or aesthetic medicine, and you have also mentioned stepping up regulation by way of the commodities laws. We have heard your views and will relate your views to the Steering Committee and the related task forces under it. I'd like to reiterate here that we are very concerned about the quality of medical services and the health of the public. As has been said, we have set up the Steering Committee, and the Steering Committee has met once. Under it, there are 4 task forces which will explore into different issues. Some of the concerns you mentioned will be incorporated into the topics for discussion. So I'd like to thank you again. At the task forces, we will discuss those issues. Thank you. I'd like to ask members whether you'd like to ask the deputations any questions. If you have questions for the administration, please hold your questions till the end of the second session. Now, please only restrict your questions to deputations. Dr. Joseph Lee, I'd like to thank the deputations for coming. I think there are 2 big camps here, one from doctors, one from the beauty industry. They have spoken their mind. Here, I don't think I should say I support either, because we are here to listen to you. I have heard from the beauty industry that you have a kind of accreditation, and that is QF4. I have heard people say that there are 100,000 beauticians. You said that roughly there are 100,000 beauticians. I'd like to ask you this question. Well, the Undersecretary may not be able to answer you now because it is not for their bureau to regulate the beauty industry, but I'd like to ask you this question. If QF4 is already in place, how many of your practitioners have reached the QF4, or do you seek accreditation from the Education Bureau? Who can answer the question? Dr. Joseph Lee, who did you think mentioned that? Well, a few of them mentioned QF4. Mr. Tong Kang Yu? Mr. Tong Kang Yu? Maybe Mr. Ip also raised his hand. Mr. Ip?
Please be brief. I'm also in the QF committee. For the beauty industry, we've already drafted the ability guidelines. And after the examinations and accreditation authority has delineated the examinations and tests, we can start to promulgate the qualifications. Well, the VTC has been commissioned as the accreditation institution. Past abilities and experience can also be accredited, and you can obtain the relevant qualifications. Well, just now we had some managers speak. Who will respond? Ms. Poon? Mr. Chairman, in fact, in the past 20-odd years, in the market, a number of beauty institutes have been organizing courses for the purpose of accreditation, UK accreditation, Australian accreditation. Some UK examiners have been flying into Hong Kong to conduct the examinations, so they're very serious. I'm also a so-called expert in the EAA. And we understand that level 4 in the QF has been applied for. In fact, the industry has been adopting a two-pronged approach. First of all, accreditation of past qualifications. Second, examinations, QF4, including IPL. Mr. Chairman, maybe this is not related to the Bureau, but maybe our friends here can offer us some assistance insofar as accreditation is concerned, what the beauty industry can do. And maybe we should also have some assistance about the definition of beauty procedures. Well, we can have the materials later. Mr. Vincent Fang, first of all, I'd like to thank the deputations for attending this meeting. Well, I believe the Bureau has already listened to a number of views just now. The DR incident is actually a medical incident. It's just that they've used the so-called signboard of a beauty parlor to carry out high-risk procedures. Well, I have to declare that I'm the honorary president of a beauty federation. Well, the whole incident is a medical incident. Is the clinic concerned suitable for high-risk medical procedures? And also they have a laboratory. Is it a bacteria-free laboratory? There's no regulation on the part of the government because all the premises are operated and managed by the beauty industry. So I'd like to have some strict regulation of the industry. Now, when I read the administration's paper, I saw that the steering committee would require a year to collect information. And preparation time for legislation will be as long as 2 to 3 years. It's really too long. Now, what immediate measures can be adopted to assist the consumers and to let the beauty industry understand clearly what they can do and what not? Lawful beauty parlors never got involved in high-risk procedures. The DR incident is actually a medical incident. So I'd like the administration to, as far as possible, do something for the consumers. You see, now consumers dare not go into a beauty parlor for anything unless the beauticians are to perform procedures by hand, that is manually. Customers dare not use any equipment. So please clarify as soon as possible. And the Secretary, I'd like to thank Dr. Lee and Mr. Fang for their remarks. As for the time required, as we have 4 task forces, one of which covering premises and laboratories, as mentioned by Mr. Fang, and there have been discussions related to various aspects. We've not yet got a timetable, but the Department of Health has stepped up patrol and inspection, as well as regulation. Just now, the Commodities Description Ordinance was mentioned. Maybe my colleague can supplement. Ms. Chang? Yes, thank you, Mr. Chairman. Just now, a couple of friends mentioned the Commodities Description Ordinance. Well, just in the last legislative session, an amendment ordinance was enacted to prohibit a whole series of unscrupulous practices. We would like to implement such provisions in the next year, and we're now preparing the guidelines. Now, this is a piece of interdisciplinary legislation covering the beauty industry, the telecommunications industry, etc. So we would like to do something about intimidating materials or misleading information. So under the new framework of legislation, we would like to do something. Next, Ms. Kwok. Oh, she's away. Mr. Wong Ting Kwong, then. Thank you, Mr. Chairman. Recently, we had this DR incident. In fact, it's not really recent. For over 10 years, I have the impression that the beauty industry is bearing the brunt for the medical profession. In the past, for a period of time, medicine and beauty were confused. I'd like to ask this. Where is the boundary between medicine and beauty? Can we use invasion as the threshold? I'd like to have the views of the authority. If we use invasion as the threshold, then certain beauty acts will have to be performed by doctors, registered doctors. And what about beauticians? If they want to perform such acts, do they need to have a license, or even for non-invasive acts? And do beauticians have to acquire a license? And what personnel should require what licenses? Under Secretary, one of the 4 task forces will look at that issue. Invasive procedures will be one of our considerations. Well, if that is the case, I'd like to ask the industry their views about standardization and differentiation. Any comments? I saw 2 hands. Well, lady first. In fact, even if you use invasion as the boundary, you have to have a breakdown. So you really have to define very clearly to what extent invasion should count. Take, for example, eyebrow tattoo, which is very simple. Is this invasive in nature? We must be qualified and experienced in performing such an act. We have to keep our job. Well, our customers come for beautification. We must not destroy their look. Beauticians have to keep their job. So in the beauty industry, we've actually consulted many beauticians who are very saddened. So what you mean is that we must not adopt a broad brush approach. Right. Okay, thank you very much. Invasive surgery or treatment is definitely a medical act. To a doctor, this is undoubtedly a medical act. For the skin, if you don't apply medicine, then of course it is not a medical act. If you're just putting on cosmetics, it's nothing medical. But if you apply medication, it's absolutely medical. And invasive acts are definitely medical in nature. Mr. Chairman, I think in future we have to be very careful about the definition of invasion. I can see that the medical profession and the beauty industry have very different views. I believe in future we'll have to handle this very cautiously. Well, we've all heard you. Ms. Mack, we should start the next session at 3:55. Is your question for the industry? Yes. Please be brief then. I'd like to ask Ms. Hui Weifeng this question about invasion. For your industry, and maybe Chen Yinping as well can answer my question. In your industry, well, the doctor was saying that even if you pierce through an acne or a pimple, it would still be medical in nature. Do you agree? And Mr. Tong, what about qualification accreditation? How many members of the beauty industry have joined the QF scheme? Just now some speakers emphasized that they're professional beauticians. Is it that after they've acquired QF4, that is level 4 of the QF, they can be called professional beauticians? Ms. Hui, to answer Ms. Mack's question, for eyebrow tattoo and pimple piercing, there's no accreditation in our industry. I think hygiene and treatment of wounds are most important. As the doctor said, we can follow his definition of how invasion should be defined. Mr. Tong? Thank you, Ms. Mack. Concerning Hong Kong's qualifications framework, some experts have already spoken on it. In fact, the QF has not been widely publicized. If you look up the hairdressing industry, the watches industry, etc., you see that recognition or knowledge about the QF is rather little. Well, in fact, some professionals of these industries have actually acquired a number of qualifications. Their certificates pile up to a height that is as tall as a pillow, so to speak. Now, many beauticians have already acquired a lot of qualifications. I am worried that our industry will be further exploited. I have to reiterate that the DR incident is not a beauty incident. Well, the Undersecretary said that she would provide some statistics and data in relation to the number of employees of various industries. I think the Undersecretary has promised us some data. So thank you very much. Deputations have spoken in the first session. I think we can invite the deputations of the second session to come in. Thank you.
Hả? 5 分鐘。